Well, I would like to thank in first place to the Committee of Encontro Ibero-americanodasdiversidades, Diversità 2024, for the invitation and for the privilege to present my work entitled Looking Over Children, the Health Lenses over Migration. So this presentation is part of the project that I'm currently conducting in Portugal at the Integral Human Development Post-Doctoral Program I am attending, entitled Social Vulnerability Effect on the Health of Migrant Children Living in Portugal. So therefore, I have to thank Católica Doctoral School, Universidade Católica Portuguesa in Portugal, for the support provided to this project. Additionally, I would like to highlight that this project was also recognized with a grant award from the Society of Rogerian Scholars Martha E. Rogers Scholars Fund. We live in a world characterized by change and diversity and also mobility of people between countries and continents. And in today's society, people relate to other people of diverse culture, origins, and different backgrounds. People's culture has a great impact on healthcare and the challenges it poses to healthcare teams. So culture, knowledge, and contexts are frequently a missing bond, not in theory, but mostly in practice in this globalized world. And in order to provide a more humanistic, unitarian, and holistic human approach, one has to understand people's world vision, beliefs, values towards an ecological world vision, and this demands a culturally competent care. During the year 2022, the European population reached about 446 million individuals, of which 23.8 million were not European citizens, with 38 million people born outside Europe. In 2022, there were about 170,000 migrants living in Portugal. These people find themselves in an interstice between cultures and societies, cohabited by stigmas, confronted and affronted with additional challenges influencing their way of being in society. In fact, the health of migrant population is perceived as the relevant indicator of inclusion. And the latest data related to migrants in Portugal in 2022 recalls us that of the total number of permanent migrants, about 62% were men, 51% had a foreign nationality, and 59% were born in a country outside the European Union. 70% previously resided in a non-European Union country. So children are the first victims of social inequalities and one of the most vulnerable group, with twice the probability of death before birth, as well as a greater frequency of illnesses. In 2022, national statistics pointed that from the total of children born in Portugal, 17% were born from mothers who were not Portuguese. So following the theme that I brought, I will focus in particular studies previously conducted in Portugal to set the base for introducing the scope of my current research. So Machado and collaborators found in 2006, and from a sample of children born in a hospital in Lisbon, that 43% had migrant mother or father, about 32 different nationalities around families. So also Machado confirmed the higher frequency of migrants from Portuguese-speaking countries and with African ethnicity. Still, Brazilian nationality remained the most common among living migrants. Nevertheless, people from India represented, however, the highest increase, about 23%. Comparative observation of the groups under study appears to reveal greater vulnerability of newborns with migrant parents. And the vulnerability of migrants arises firstly from characteristics such as employment, type of employment, education, and housing. The percentage of unemployed and unskilled mothers and fathers was found to be significantly higher in the migrant group. In this group, level of education was also lower, both for the mothers and fathers. In 2013, Topa, another researcher, recovered the thematic analysis of accessibility to maternal child health care by migrants in Portugal through the perspective given by 30 migrant women and 14 pregnant migrant women. Results showed in general that patterns of demand for health services for pregnancy surveillance were late. The experiences revealed the multiple and differentiated obstacles they encountered, whether cultural, informational, economic, communicational, bureaucratic, or related to family aspects, when they accessed or tried to access healthcare services. Another researcher, Macedo, revealed through his study in a sample of hospitalized children in also a Portuguese hospital, there was a relationship between the number of hospitalizations and the education level of parents. Ethnicity also influenced the health status of children, and African ethnicity had a higher number of hospitalizations and length of stay. So common barriers identified in previous studies concerning healthcare assessment by migrant people are here presented, like, for instance, lack of information on rights and conditions of access to the National Health Service, lack of trust among some migrants in a system different from that of their countries of origin, communication difficulties due to the lack of knowledge of the Portuguese language, lack of sensitivity and competence of some health professionals to deal with the cultural diversity of patients, and discriminatory attitudes of some health professionals. Also, behavioral and cultural perception of the need to use formal health services, namely related to disease prevention, and the lack of financial resources such as poverty. These were the common barriers between previous studies. So perpetuated needs lead to the accumulation of deficiencies and in turn negatively determine health and quality of life from the beginning of the life cycle, even in the mother's womb. Social inequalities compromise access to basic health resources and the quality of care received and or provided, determining well-being, quality of life, and life expectancy related in numerical indicators such as mortality and morbidity. Due to what was first mentioned, I present to you my current study, which is an exploratory observational mixed method and cross-sectional study, which comprises 2 stages of development in accordance with the aims of this research project. So this study received already approval from 2 ethic committees, and it comprises one first part, a quantitative method. This first part of the study will answer the following research question. Does social determinants have a statistically significant relationship with the health of migrant children living in Portugal? Data collection will include clinical records of all migrant children and children with migrant parents hospitalized in the pediatric hospital department. Additionally, children with migrant mothers born in the same hospital will also be included. Retrospective data is being obtained from the last 5 years of hospital records. And a quantitative analysis will be performed resorting to the SPSS program. The second part aims to identify the patterns of health surveillance, care, and access to infant and juvenile healthcare services by a sample of migrant parents, and comprises interviews to migrant parents recruited through a snowball effect. Analysis of qualitative data will be conducted through the NVIVO program, and a SPSS program will be used on quantitative data. Therefore, a non-probabilistic and convenience sample will be obtained. Finally, it is expected that the research results will call on organizations and institutions to take on the challenge of regulations, policies, and actions based on caring for migrant children and or supporting migrant parents in their health standards and access to healthcare. Also justify health literacy and availability of financing and essential resources for humanized and humanizing care since early stages of life. So thank you very much for seeing my presentation. And this is my contact. Hope to hear some feedback related to my work. Thank you very much.